Hello, everyone. Welcome back to our channel. Today, we are going to discuss a very important topic, zinc deficiency in the elderly. As we age, our nutritional needs change, and certain deficiencies can arise. Zinc deficiency is one such issue that often goes unnoticed but can have significant impacts on our health. So, let's dive in and explore the importance of zinc for the elderly and how to prevent its deficiency. Now, let's get started. Zinc is an essential trace element for human health and well-being. It assumes structural and functional roles in a large number of macromolecules and is required for more than 300 enzymatic reactions in the body. Zinc ions are involved in all aspects of mediating metabolism, transmission and regulation of genetic information expression, storage, synthesis and activity of peptide hormones, and structural maintenance of chromatin and biofilms. Therefore, zinc is required for growth and development, protein and DNA synthesis, sensory neurosensory functions, cell-mediated immunity, thyroid and bone metabolism. The human body contains about 1.4 to 2.3 grams of zinc. Zinc is mainly found in muscle, 60%, bone, 30%, and other organs, 10%, such as liver, kidney, pancreas, brain, skin, prostate. Daily zinc requirement of a person adults are 15 mg and normal serum zinc concentrations are 84 to 159 micrograms per deciliter. Long-term high intake of zinc together with reduced absorption efficiency can seriously affect and consequent zinc deficiency in the elderly. Indeed, moderate zinc deficiency is often observed in the elderly, even in developed countries. Zinc deficiency in the elderly may be responsible for increased rates of infections and age-related degenerative diseases, including decreased taste, oxidative stress, altered immune function, neurological disorders. Thus, zinc has an important role for the elderly because it is related to psychological functions, nutritional status, immune system and antioxidant, bone metabolism. Despite its important role, zinc often does not receive much attention in developed countries because severe zinc deficiency is uncommon. In contrast, in developing countries, zinc deficiency is a public health problem, which affects mainly the elderly and children. The elderly have a higher risk of zinc deficiency than the general population. Previous studies have shown that zinc deficiency can cause DNA damage. Recent new research is a step forward in understanding how zinc deficiency can also lead to systemic inflammation. While some inflammation is a normal part of the immune system's defenses, excessive inflammation has been linked to degenerative diseases ranging from cancer to heart disease. With a zinc deficiency, the body's ability to repair damage can also be reduced. Zinc deficiency in the elderly can lead to scaly skin rashes, especially the skin around the mouth, on the hands and in the groin. Older people who don't have enough zinc in their bodies can also experience problems like diarrhea, loss of appetite, and an increased risk of infections. Hair loss and slow wound healing can also be signs of zinc deficiency in older adults. So when doctors notice impaired immune function and an increased susceptibility to infection, along with poor wound healing and poor appetite in the elderly, they should consider checking the person's blood zinc levels. Although there are potential warning signs of zinc deficiency in the elderly, these are non-specific and therefore difficult to diagnose and detect, unless zinc deficiency is severe in the elderly. In addition, diagnostic testing facilities also have many limitations. Current blood zinc concentration is the commonly used means, but it is unreliable because it does not accurately reflect the amount of zinc in the body, nor is it sensitive to zinc deficiency in the elderly. The best way to prevent zinc deficiency in the elderly is to get more zinc, specifically 11 mg per day for men and 8 mg per day for women. Lean meat and seafood are good food sources of zinc, with oysters having the highest zinc content from food. Grains and other protein-rich plant-based foods like beans and nuts are also high in zinc. But if you only eat plant-based foods, you may not absorb zinc well and will even end up eating more due to interactions between nutrients. For older adults who do not eat a lot of meat and are at risk of not meeting the zinc requirements of the elderly, multivitamins containing zinc may be an alternative, provided the patient is provided below the maximum dose of zinc, which is 40 mg per day. Older people who are not used to eating a lot of meat, elderly people who are suffering from frequent infections or diarrhea can take a zinc supplement for a while and see if the diarrhea improves or the frequency of infections. Did the infection decrease? It is important to remember that zinc can cause toxicity when taken in large amounts. Zinc supplements for the elderly should not exceed the upper limit of 40 mg per day. Taking too many zinc supplements can lead to vomiting, diarrhea, cramps, and headaches. Zinc can also react with certain medications, so the elderly, who often have underlying medical conditions, need to tell their doctor before starting any supplements. That's all for today's video. I hope you found this information valuable. If you have any questions or want to share your experiences, please leave them in the comments below. Don't forget to like this video and subscribe to our channel for more informative content. Thank you for watching, and I'll see you in the next video. Take care and stay healthy. Thanks for watching.